right. Hello, everybody. Today is the last day of the content, and we're going to end the class with a very happy moment. So let's talk about pregnancy, labor, and delivery. Okay, so in the first trimester, the most common symptom that women experience is an absence of their menstrual periods. But then keep in mind that some women, and I know I had this experience, spot a little bit when the embryo implants in the uterine lining. And so you might think that a period's coming on, but it's not. Some of the earlier symptoms that women experience: morning sickness, which is nausea and sometimes nausea and vomiting. I learned from experience from my friends who've been pregnant, trying to keep food on your stomach at all times, even to the point of like sitting up in bed and maybe eating some saltine crackers, whatnot. I remember in my experience, I sleepwalk, but I would like sleepwalk and eat yogurt. And it was the yogurt because I could just like eat it really quick in the middle of the night. You know, it wasn't like I had to chew or anything, but just keeping food on my stomach 24 hours a day. And a lot of women say that helps. The breasts get very sensitive, very tender and enlarged. I know I had the experience of like looking at my shirt going, whose are these? This is not ordinary. Lots of urination, frequent urination, and then a higher basal body temperature, so slightly raised temperature. Sadly, about 25% of babies go through a spontaneous abortion or miscarriage. And younger women, we believe the body is able to recognize more thoroughly in younger women than in older women who are pregnant if there is some kind of genetic problem with a embryo. And so a lot of times what is a miscarriage, which can be very, very sad for mom, family members, partner, whatnot, is actually the body getting rid of an embryo that has problems. Okay. Some of the reason why older women are more likely to birth a baby that has genetic defects is because not only do older women tend to ovulate more than one egg, it's kind of like the body saying last chance to get pregnant, let's make some babies in older women. And that makes some sense in terms of evolution. But there's also in older women, the body's not as good at recognizing when there is a problem with an embryo. And so in some cases, what would have been a baby that she would have miscarried much younger, she might actually carry to term when she's much older. Does that make some sense why we have some of those problems in the older women with pregnancies? We've already talked about the eggs, like we're born with the eggs that we will have all of our life when we are women. You can do a urine test or a blood test. Blood test is more accurate than the urine test, and it's looking for HCG, which is a hormone that our body starts producing after 2 weeks after implantation. And so the hormone is going to be produced right about the time when we would have expected to have a period. Okay, so ovulation about halfway in the menstrual cycle, and then implantation a couple weeks after that, you can test positive. Uterus size, shape, and consistency starts to change. And about 16 to 18 weeks, so we're right in between the first trimester and the second trimester, there's what's called quickening. And quickening is when you can start to feel baby move. Okay, I remember at first feeling a little bit like maybe I had gas, but then it would kind of flutter. It would feel like it would flutter like a butterfly was in there. It was just kind of this little feeling that you would get. And I can tell you for a lot of moms, that is a point of bonding, you know, sort of like there's life, you know, there's life form in there and you can start to feel it moving around. Any questions about first trimester? Okay. In the second trimester, let's talk about a normal gestation for a human is 40 weeks, and 37 to 42 is considered to be full term, but 40 is the average. The uterus can grow up to 5 to 6 times larger, so pretty amazing how big that uterus can get. The cervix starts softening, which makes some sense because the cervix is going to, which normally is held nice and tight. It starts to soften so that it's starting to prepare for the contractions that are going to pull it open and allow for birth. The vaginal lining thickens, and that is adaptive so that women aren't injured when they're birthing a baby. And the breasts get very enlarged and start to prepare to lactate and make milk. Okay, so some of that early on, some of the breast tenderness and swelling isn't real functional, but late in the pregnancy, it's very functional. They're getting ready to nurse a baby. Digestive changes, the morning sickness part that we've talked about would be nausea. And keep in mind, they call it morning sickness. My experience, especially with my first pregnancy, was it was all day and all night. It was not a morning thing. I wish it would just end in the morning, but it kept going around the clock. With my second pregnancy, I had some morning sickness, but not nearly like around the clock and forever, or all the way through the pregnancy like I had with my first. Hyperemesis is when there is uncontrollable vomiting. And this is a very, very dangerous medical condition because mama can dehydrate. Remember, we talked about holding 50% more blood during a pregnancy. And so dehydration is very dangerous for fetus, very dangerous for mama. As well as if she's vomiting chronically, she's not getting adequate nutrition. Okay. And we'll talk I think it's the next slide. This usually involves IV fluids and a lot of times hospitalization. Women tend to experience more constipation during the pregnancy, and that's one of the reasons why they're very much encouraged to push fluids. But then they're peeing all the time. So it's like push fluids, you're peeing all the time, but that can help prevent the constipation. And then the heartburn, women are more likely in the second trimester when the baby's up high and kind of pushing up on the stomach and the esophagus, she's more likely to experience heartburn later in the pregnancy, but not at the end of the pregnancy. At the very end of the pregnancy, the baby lightens and it drops, its head drops into the pelvis. And then the belly, it's interesting, like she might have her belly here and then her belly really protrudes when the baby drops its head down into the birth canal. That tends to free up the heartburn, but then it creates all kinds of additional pressure issues down below. Okay. Cardiovascular changes, blood volume increasing 50%. Her bone marrow is going to create more red blood cells because she is certainly feeding uterus, feeding placenta, feeding a fetus, as well as feeding herself with those oxygenated red blood cells. Heart rate tends to go up about 15 beats per minute because cardiovascular system's working a little bit harder. And then some women get varicose veins in their legs. I thankfully never had that. And then many women get edema. And edema is when you get swelling. And the most common thing that happens to women, this tends to occur more frequently at the end of pregnancy. Her body's just having a hard time circulating the blood and clearing it. And so fluids start to accumulate, particularly in the feet. I've known women who had to change what shoes they would wear towards the end of their pregnancy. And also know, this happened to me and a lot of women, my shoe size increased after pregnancy. So you get some swelling in the feet and then it kind of stays permanent. Feet can get bigger. Many women also will have swelling in other parts of their body, like in their hands. A lot of women, if they wear rings, they take their rings off towards the end of pregnancy so that it doesn't get stuck on there when the fingers are swollen, that type of thing. Okay, respiratory, this would be some shortness of breath. And again, when baby's up high, kind of pushing up on the stomach and pushing up on the lungs until the baby lightens. And then that tends to end after that lightening when baby goes down, puts head down in the pelvis. Urinary, lots and lots of urination. And it makes sense. I mean, your kidneys filter your blood. And if you've got 50% more blood volume, and then your kidneys are working nice and hard to clean up that blood for mama and for baby, there's going to be lots and lots of extra urination. Okay. And the way I kind of thought about it is particularly the symptoms that happen at the end of pregnancy. For a lot of women, you're just kind of like at that point in time feeling uncomfortable enough that you're ready to have a baby. It's like, it's kind of motivating. It's like, let's get this over with and let's bring this baby into the world. Musculoskeletal, there is a hormone that women have when they're pregnant that's called relaxin. And relaxin makes joints more flexible, but what it's doing is down in the pelvic region is it's relaxing the joint down there, getting the pelvis ready to open up. Does that make sense for the birth? And then at one point in time, it's easy to get off center, like there's so much weight out in front. It makes sense that a lot of women have to lean back. They're kind of leaning back to be able to keep their center of gravity. And then there's a waddle that happens that you can't help at one point in time later on in the pregnancy. And then in the integumentary system, which is skin, a lot of women get stretch marks, and you can kind of see she's got stretch marks there. I was fortunate not to ever have those. I got big, but I kept nice and moisturized. And for some reason that didn't happen. A lot of women get freckles on their face, freckles all over their body. You just get an increase in skin pigmentation. And then most women get this linea nigra, and you can't quite see it in this picture, but it's this black line. It's this black line of pigmentation that goes from navel down to pubic bone. And that's very common in pregnancy. In some women, it goes away. In some women, it kind of stays permanent. Questions, comments? Do we have any moms in this class? Okay. Weight gain. We do know that women who remain underweight tend to have complications, particularly small birth weight fetuses. And women who are obese tend to run at higher risk in pregnancy, and they're encouraged not to gain as much weight as, say, a woman who starts out her pregnancy at a average or normal weight. We know that exercise is very beneficial to fetus and beneficial to mom. During both of my pregnancies, I continued running. It became like a slow jog at some point. It wasn't necessarily running. And I was able to keep lifting gentle weights all throughout my pregnancy too. And I think that really helped me stay fit, and it really helped in the birthing process. We know that a weight gain about 25 to 35 pounds is normal weight gain. And keep in mind that, underweight women are more likely to have a low birth weight baby, which is usually defined as 5.5 pounds and below. And then a high birth weight baby is about 8.8 pounds and above. And that's usually a mom who has gestational diabetes. So typical babies between 5.5 pounds and 8.8 pounds, and mama is usually recommended that she gain 25 to 35 pounds. Okay. I found, and as a body image researcher, I found it interesting when, during my first pregnancy, where I had so much morning sickness, and I would go visit my obstetrician, and she'd be like, Denise, you need to be gaining weight. You need to be gaining weight. I'm like, I'm eating as much as I can, but there were times where I was vomiting some of it up. And then I moved into my second trimester, where you start feeling a lot better if you have morning sickness in the first trimester. Moved into my second trimester, and all of a sudden my body just started gaining weight. Like I felt like I was eating the same, but my body started gaining weight. And I still remember my obstetrician going, Denise, you're gaining weight too quickly. And it was just one of those like, look, lady, I'm doing the best I can here, and I'm eating normally. I'm well nourished, and I'm sure my fetus is well nourished. I can't control that, that kind of thing. It's like, yeah. And you don't want to give a new pregnant mom an eating disorder, making her restrict her, that kind of thing. We need to make sure most women are put on prenatal vitamins if they're trying to get pregnant ahead of time. But during pregnancy, certainly most women are put on a prenatal vitamin. It's a nice big horse pill kind of thing. And there's certainly certain nutrients that she's going to need more of. She's going to need to increase her calorie intake in order to, because all the energy she's expending on growing that baby. And then the calorie increase is even higher when she's nursing. Okay. It takes a lot of energy to nurse a baby and feed a baby once it's born. But more calories are certainly needed. Okay, at pre-labor, most babies drop or lighten around 1 month prior to birth. Mine, it was like clockwork for both of them. Like they dropped exactly 1 month ahead. And so I thought that was kind of amazing and just a good way of predicting when they were coming. And so what happens is baby tends to be up high and then head drops down into pelvis, which mama can feel. You saw all this pressure down there. And then stomach kind of goes, or abdomen goes like way out. Okay, it kind of goes from up here under the chest and then way out. And I can tell you when that head is in your pelvis, you can feel it. My younger son, was born and he looked like Humpty Dumpty. Like he had this little body, little chubby body, and he had this big, huge head. And it hurt a lot more birthing him with that big, huge head than my first son that had more like a normal head. But I still remember standing in line in the grocery store, getting ready to check out my groceries. And Forrest turned his head in my pelvis and my legs gave out. It's like it hit those sciatic nerves. It was like, boom, I was just down. But boy, you can feel that when it's that pressure down there. And then when they turn their head, you're like, ah. Ideally in birth, a baby is face down. So one way of thinking about it is they come out looking at your butthole, but that is a very healthy position and the best possible position for birthing. Okay, so they're face down in that occipital posterior position. The first, in preparation, they're called Braxton Hicks contractions. And this is oftentimes women think they're in labor, but it's false labor. It's not true labor, but it's early contractions. So and you can even watch this stuff kind of happening. You can sort of see the contractions happening. And that starts helping the effacement. The effacement is like, imagine this is the cervix and there's a cervical plug in there, which is this really mucousy kind of thing. It starts pulling that open and in preparation for childbirth. Best way to tell if it's a Braxton Hicks contraction versus a real contraction. Braxton Hicks contractions tend to only happen when mama is relaxing. So if she's having them and she gets up and she walks around, it ends. Okay, the Braxton Hicks go away when she walks around and it ends. When you're in real labor, you get up and walk around. I still remember my first son, I came home from internship that day and I got on the treadmill and I was jogging on the treadmill and I found it interesting. I could not stand up straight on the treadmill. Like I was kind of like bent over as I was just sort of jogging. And then later on that evening, I realized like, oh, walking around, oh, I had to lean over. And it took me a while because he was a little bit early. It took me a while to register like, oh, I'm having contractions. And when you have contractions in your uterus, you want to lean over. Okay. It's hard to stand upright. But with the Braxton Hicks stuff, you walk around and it goes away. And then you don't hear a lot of people, talking about this because it's kind of gross, but loss of that mucus plug, which is a very thick, gelatinous, slightly bloody, but kind of clear plug that just kind of falls out. And when it's a weird kind of sensation. But that is where that, again, at the closing of the cervix, that mucousy plug keeps fetus from getting any kinds of infections. Does that make sense? So not only is the cervix nice and tight, which is a good thing to carry a pregnancy, but then that mucus plug keeps anything from getting in there, kind of separates mama's vagina from cervix and baby. Questions here? I got anybody grossed out yet? Okay. Okay, 3 stages of labor. The first is lots going on here, but it is the contraction that a woman feels. And I can let you know, and then the woman we're going to feature here said the exact same thing. The first sensation that mama starts to feel, it feels like heavy menstrual cramps. Okay. And most of the contractions are felt down in the lower abdomen because as every contraction occurs, it contracts on each side and it's slowly pulling the cervix open. Okay. You're also going to hear from the mama that we feature here today is back labor. I had back labor during my second, but again, Forrest had a Humpty Dumpty head. I did not have back labor at all during my first birth. It was just all in the front. And those contractions keep going until a woman is at 10 centimeters. Okay. I found it funny, your dignity. It's hard to go in and keep all your dignity when you are in labor and delivery. And I still remember like nurses would come in and they would go inside and put their fingers in there. And depending on how many fingers they could get in the cervix, that's how they would tell how dilated you are. And then doctor would come in and check you. And then my joke was, even the janitor comes in and checks you. It was like, everybody's had their hands inside of you on that particular day, checking to see how dilated you are. And you just got to roll with that kind of stuff. In the second stage of labor, the baby is delivered. So mama pushes and baby ideally comes out pretty quickly. Mine, I only had to push a couple times for both of my guys and they came out pretty quickly. Some women spend hours at this stage and I can't imagine how utterly exhausting that must be for them. At times when mom is so exhausted and labor is not progressing, that's when they will do a C-section at that point in time. And then after baby comes out, the third stage of labor is birthing of the placenta. And keep in mind, the placenta is the sac and the lining that held the amniotic fluid in around the baby. And it is the placenta that is the interchange between all of mom's blood and baby's nourishment, baby's food, baby's blood flow, all of that. And the placenta, it's very important. They midwives, obstetricians are very, very careful after birth of a child. When that placenta comes out, they count all of the lobes and make sure that there's no bits of placenta left inside of her. Because if there are bits of placenta left inside of her, she's going to keep bleeding through that. She's going to be exchanging blood into that placenta and can bleed out and die. Okay. Now, even in our own College of Nursing, I did not know this when I was making babies, and I don't think anybody was really practicing this back then. They used to, and many still do, as soon as that baby comes out, even before the placenta is birthed, cut the cord that is now our belly button, our navel, which is where we got fed in utero. Normally they would clamp and partner would get to cut it, mom would get to cut it, or doctor would cut it, nurse would cut it, that kind of thing. Even in the research in our nursing program here at ASU, they have found if they allow that baby to remain attached, so baby gets birthed, baby is continually getting fed through that placenta, and that's a good thing. And keeping baby attached actually helps mom birth that placenta. Okay. Now, one of the things that they will do, I never had to have this done, and I was really glad because I knew women that said, oh, that was so painful. But a lot of times when that placenta doesn't birth quickly, they come in and they do this massage thing, this really deep kind of massage on the belly, they're trying to contract the uterus and help the uterus birth that placenta and get it out of there. Sometimes they'll even give women more hormone, more like oxytocin, to try to help birth that. Also for women, a good way of helping get that placenta out, as soon as baby starts nursing, and a lot of times they will, right when baby's born, they want the baby to have skin to skin contact. And for a mom who intends to nurse, they will encourage that baby to go ahead and start nursing and feeding, which is a beautiful bonding kind of thing that can occur. But as soon as that baby starts latching onto the nipples, the body is producing oxytocin, which is both the hormone, that's the love hormone. Remember, we talked about that, but it also is the hormone that creates uterine contractions. And so by baby stimulating the nipple, it is going to create more of those uterine contractions and help birth that placenta. Questions there? And some people, I did not partake in this, and I would not want to partake in this. Some people like to keep the placenta, and they actually, I don't know how you cook it. They cook it somehow and they eat it. They think it's really, apparently it's full of nourishment, you know, but no, I would not want to go there. That's gross, isn't it? Yeah. Okay. Okay, coping during labor. We know, and things really changed over time. Back in the, if any of you are Mad Men fans and you watched Mad Men, the way that they birthed back in the 60s and the 70s in a hospital was, by my standards today, awful. They would have women laying flat on their back. They would anesthetize them so that they were just drugged out. So a lot of times they ended up birthing a baby and they couldn't remember any of it because they were just so out of it. When you anesthetize women with systematic, like you give her a narcotic that is in her whole bloodstream, baby is going to be narked out and sedated, and that's not good for baby's breathing. And it made for more difficult labor for women because they weren't awake and alert and able to push nearly as well. And they absolutely, back in that day and time, nobody was allowed in the delivery room. So if there was a woman partner, a male partner, a mom, you know, mom wanted to tend and help her daughter with her birth, friends, nobody was allowed in. And we've learned over time with research that things go better if a partner is there, if family members are allowed to be there. And then we've talked a little bit about the data on the doulas. Remember, the doula, she's usually not an obstetrician, not a midwife. The doula, normally she meets with a doula prenatally, like she meets with the obstetrician prenatally. And the doula comes in and just helps the mom cope. She does anything that she needs. She might feed her ice chips. She might help her with her breathing. She might massage her back. I know with Forrest, when I had back labor, I wish I'd known this then. I did not know this then. I did not have a doula. If you put really hard pressure on the lower spine, it helps with that back labor for women. And I just kind of suffered through the back labor. I didn't know that there was anything that you could do about that. So the doula just caters to her, might make phone calls for her. You are normally not allowed, and they encourage you to start your birth, whether you go to the hospital or your home birth, and not eat anything. And I cheated for both of my babies. As soon as I went into labor, I went and made myself a big breakfast because I was like, I would not run a marathon and not have some food on board. And it was fine because I had digested it fine by the end. And they also won't let you drink. And the reason why they won't let you eat or drink is if you're going to need a C-section, they're going to need to do anesthesia. And remember, anesthesia makes you nauseous and vomit, and they don't want you vomiting and asphyxiating if you need full anesthesia for a C-section. The other reason why they won't let you eat or drink is that a lot of times women vomit during labor. Okay. I still remember my first birth. because it was so long. It was just so long, 24 hours at least. And I was so thirsty, and I kept begging the nurse for something to drink. And she finally came and she gave me a Sprite and a straw. And I still remember her attitude. She handed it to me. She said, well, we're going to see this again. And we did. I drank it, and right before I pushed that baby out, I vomited my Sprite. So yes, we did see it again, but it tasted really good when I got to drink it. Okay. Prepared childbirth. Keep in mind that Lamaze is only one very specific type of prepared childbirth, but a lot of hospitals, birthing centers, midwives offer prepared childbirth. And I attended a class for my first child, and I found it to be actually very helpful. They just explained so many things. And I felt like having that knowledge on board really helped me to understand. So as an example, strongly encouraging women in labor to be able to walk around, let gravity do its work. Okay. If you are lying flat in the hospital bed, even during the birth of a child, that baby has to go up to go out. And so the more that mom can be walking around, the more that mom can be upright. I even found during my first birth, I had very rhythmic, kind of predictable contractions. During my second birth, it was so different. It was like jabby. It was just really just like, it was irregular. So I couldn't kind of predict when it was coming, and just very jabby. But I found that the more I could get myself almost squish my abdomen, which makes some sense. So instead of the contractions, like when you're all expanded, contractions when you're all squished up, I found that really helped me cope. And I learned that from the prepared childbirth. Try to move over as much as you can with that big belly in between. Don't lay flat. I also found it really fascinating that there's a point in time in delivery where the most challenging part is birthing the head. And again, if baby's down there facing down, is getting that head out. But there's a really strong urge after, once you're pushing, and keep in mind, you're only pushing when the contractions are happening. So there's a lot during labor and delivery where you're just hanging out, nothing's happening. And then a contraction will occur, and then you're coping with it. And then everything relaxes and you're just kind of hanging out again. Or I even was sleeping a little bit in between when Christian was born, because it was just such a long labor. And I went into labor that evening. I had been up all night long, and he wasn't born until late that afternoon. So even sleeping in between. But after mom births the head, whoever's delivering the baby has to tilt the baby so that the shoulders can come out. Because if that baby comes out with their shoulders in exact same position that the head came out, it can really harm mom. Okay. You want those shoulders to be able to collapse and not be fully expanded in that baby. So they get the head out, and then mom wants to push at that point in time, but they'll usually have mom do some breathing where she's resisting the pushing. So maybe like that kind of thing. And then they're like, okay, one more push. And usually that one more push after they've got the shoulders out, baby's born. Okay. So they do a lot of educating and helping women understand. They even encourage things like, my mom's generation called them the pains. And they even encouraged us to call them contractions, because contractions, if you think about it, just even the semantics of the word, the contractions are functional, right? Yeah. And it does hurt. It hurts. Pains are for real. But it makes some sense to kind of try to frame it that way and call it what it is. But to understand why the body is going through what the body is going through. Okay. I've worked clinically with women who had no idea what was happening to their body during a labor and delivery. I've even worked clinically with women who had no idea how they got pregnant, even though they were sexually active. And so ignorance can run pretty deep. And so the idea here is, if you give women and partners information. It can be very valuable information. Take away some of the fear that could be occurring. They do a lot of, in these prepared childbirth classes, teaching women relaxation exercises, teaching women how to have a focal point. My friend, my best friend, and both of her births, well, no, actually in her first birth, she had a picture of her dog that she would focus on. In her second birth, she had a picture of her first baby that she would focus on. I had, my focal point was I had hung up across the room my little blue outfit for my baby, and I focused on the outfit. I was like, I'm going to fill that outfit with a baby kind of thing. And I just really tried to look at that while I was doing my breathing and coping. And a lot of times teaching women self-hypnosis. So just really being able to relax. And this is why this is so important. Normally for a woman, if she did not have all of that going on, she would want to tighten up every time she had a contraction, because it hurts. And so your instinct when something hurts is like, ah. But the more that a woman uses her energy in doing that, the more she's going to exhaust herself, as well as the more she's tightened up all over, the longer labor is going to continue. Like, it's not going to go quickly. You want to be using your energy to allow the contractions, the uterus to open the cervix, but not using your energy elsewhere. So other than like walking around, ideally women are doing this relaxation training during their contractions to cope with their contractions. Usually it's very deep breathing early on in labor. So more of a like in through the nose, out through the mouth when a contraction is happening. Later on in labor, women are encouraged to pant when it's like that cervix is getting really, really dilated. And so more of a that kind of thing helps with pain management better at that point in labor. Then she's pushing, and like I said, after the head's out, she has to pant a little bit again to give them time to get those shoulders in the right position. Questions about prepared childbirth? I highly recommend it. Can be very informative for women, very informative for partners who might be involved, teaching partners things that they can do to help mom cope, that kind of thing. So in terms of pain control, only about 8 to 10 are particularly difficult. Again, they used to use systemic medications. So like give women opioids, narcotics during labor and delivery. That is not good for mom. It's not good for baby. Nowadays, they tend to offer, if a woman is unable to do natural childbirth without pain management. And I remember I went into both of mine thinking, I have no idea what this is going to feel like. I mean, they try to tell you during prepared childbirth, but you just don't know. I went in with an open mind. I went in with like, okay, I'm going to do the best I can to do this naturally. But if I feel like I want pain medication, I'm going to ask for it. They normally tell you that when it comes to getting an epidural, that's usually an anesthesiologist who does that, if not the obstetrician. You have to lean over and they put a needle in your back and into your spine, and then they drop narcotic and a numbing agent down into your lower spine. And so that tends to numb from the waist down. But they will tell you that you can't be at the end of labor and get that epidural, because at the very end of labor, when things are really intense, they're not going to be putting a needle in your spine. You've got to be in between contractions, and you've got to be calm, and you've got to be able to lean forward as much as you can and stay very, very still when they put that needle in to deliver that epidural. Okay. I had quite an effective epidural during my first pregnancy. I still remember my partner was not necessarily hearing my message, but I would have some intense contractions, and I would just say very calmly, I want to know my options. And then I'd have some intense contractions, and I would say, I want to know my options. And then finally I had a particularly intense one, and I said, I want to know my options now. And then it was like, scurry out and go get the doctor. They came and gave me an epidural, and it was very effective. And I know a lot of women really don't want that, but I found it to be so peaceful. Then I could just focus on the joy of what was happening. Like, I wasn't so focused on coping. I could just relax. And it wasn't too long after that that I was able to push. Some women find that they can't push as effectively with an epidural. I didn't find that to be the case. During my second delivery, my doctor gave me an epidural and put the medication in there, but it didn't take. And I was doing absolutely everything that I could. And again, with Forrest, it was just very irregular, very jabby, very like, like quick and just all over the place. I was doing everything to breathe and to cope. And thank goodness my obstetrician, he comes in, and I remember he got down in my face and he said, Denise, you're not getting any relief, are you? And I was like, no. It's like, I got the epidural, but it wasn't working. Okay. It wasn't giving me any kind of thing. And he's like, I'm going to dose you again. And he dosed me again. And at that point in time, right when he dosed me again, I started pushing. It was like, I got the relief. If I had known I was that far and I was about to have a baby, I don't know if I would have needed it, but it sure was nice to be able to push him out and to have some numbness and some relief down there. Okay. The other kind of blocks that they do, and then that wears off. Like, for a little while, your legs are kind of numb and you can't walk around, but it wears off. And then a pudendal block is where they just go in the vulva area and they put numbing agents in there. That's going to do some good, particularly if she tears during delivery. And we haven't talked about an episiotomy. Let's go ahead and talk about that. Sometimes what they will do is put fingers in and stretch. And some women will even do a lot of that stretching pre-labor to try to get that vagina nice and stretched out, which is not normally what you think you want as a stretched out vagina. But anyways, they will do some of that stretching to try to prepare for that baby's head to come through. And so sometimes obstetrician and midwife, they'll do that. They'll put hands in and try to kind of stretch. But then sometimes they want to do an episiotomy. And episiotomy is when they cut, so in between the vagina and down towards the rectum, and they make for more room. And there are some women and some midwives and some obstetricians that have very strong opinions about episiotomies. There are some that are like, we're absolutely going to do an episiotomy if we need to. And there's some that are absolutely like, no, I don't do episiotomies. Okay. I had it both ways. And again, some people have very strong opinions about this. I had an episiotomy with my first, and remember, he had the small head, well, the normal head. And they stitch you up afterwards and then you heal up. Okay. My second birth with my Humpty Dumpty baby, my doctor was very anti-episiotomy. And in birthing Humpty Dumpty head, I tore. And I wish I had had a straight line episiotomy and stitches, but I ended up having to have stitches like in different directions. And it was a much more uncomfortable recovery on my bottom after that. So if I'm not having a third, but if I did, I would probably ask for that episiotomy. So this could help. The pudendal block could help with that kind of pain, but it's not gonna be deep enough in there to actually affect the feeling of pain from the cervix dilating.
I have a question.
Okay.
And you don't have to answer this, but did you do perineal massage for either one of yours?
I did not, and they did not talk about that in prepared in the childbirth class, and I didn't know about it. So I did not, but that's probably why I had some, I mean, like many women, either episiotomy or tearing. Yeah. Other questions? I hope I'm not disclosing too much today, you all. That you won't be able to look me in the eyes again. Okay, some complications. Gestational diabetes, they regularly screen women for this. And I still remember going in for my blood test for gestational diabetes when I had a bunch of morning sickness. And what they want you to do, this is like not what you want to do when you have morning sickness. You have to get up and not eat and not drink, go into the lab, and then they draw your blood and take a look at your fasting blood glucose, and then they give you this really sugary drink, which is not what you want for breakfast when you have morning sickness. And I still remember drinking it and asking the nurse, I said, what if I lose this? What if it comes up, kind of thing? And she said, then you come back tomorrow. And it was one of those like, okay, mind over matter, keep it in kind of thing. And I was able to endure that. And then what they do is they get X amount of sugar in that drink, and then they check your glucose levels from your blood a couple of times and just make sure that your blood glucose levels aren't going way high and staying high. Because if they stay high, that's gestational diabetes. If it goes from like fasting glucose way high because of the drink, and then it's starting to taper down, then that means that your pancreas is producing insulin and it's doing what it should, and that you don't have gestational diabetes. Okay. So they regularly screen for that. And keep in mind that women with gestational diabetes are going to have a macrosomnia baby, which are really large babies. And large babies are more likely to require a C-section. Large babies are more likely to develop diabetes themselves. So this is one of those interesting intragenerational kind of things that, and keep in mind, lack of exercise during pregnancy and then being obese during pregnancy is going to be a risk factor for gestational diabetes. And then having a family history of type 2 diabetes is also going to be a risk factor for gestational diabetes. But that's one of the places where mom's behavior times her genetic risk. If she gets gestational diabetes, is more likely to have a child who's going to have diabetes. So it crosses generations. Okay. Hyperemesis gravidarum. Gravidarum means during pregnancy. Hyperemesis means too much nausea and vomiting. So emetic, if any of y'all ever had Ipecac in your house, that's an emetic. It would, if you drank poison as a kid, you drink the Ipecac, it'd make you throw up. So too much vomiting. And this is, again, like I talked about, a very serious medical condition. Oftentimes she's treated with IV fluids, mom is, to try to help her stay hydrated. Oftentimes she's treated with anti-nausea medications. The problem with the nausea medications, they work very well for the nausea, but they're very sedating. And so it's not if you've got to go to work and move around and function, it's not a very good option. Many of these women require hospitalization. One of the royals had to be in the hospital for a while during her pregnancy because she had this hyperemesis. Any questions there? Okay. Placenta previa. So remember, the placenta is the organ that is the interchange between mom's blood and then baby getting fed through the umbilical cord, and so baby getting all of baby's oxygen and nutrition. Placenta previa is when the baby's still in there and a part of the placenta starts to tear away from the uterus. Okay. This is especially common where the cord attaches to the placenta. Ideally in mom, that is nowhere near the cervix. Ideally that connection is anywhere else in the uterus, but not near the cervix, because it's more likely to pull away. And she's going to have premature bleeding if that occurs. So if the placenta starts to tear away, mom's going to have unusual bleeding down there. And that is a medical emergency. Because if it's pulling away, it's going to want to deliver. And if that baby's premature, that's going to be problematic. And if it's pulling away, baby's going to lack in nutrition, lack in oxygen and lack in nutrition. Okay. And so this is rare, but it's highly dangerous when it occurs. I can also let you know, I had a friend that this happened to them, and it happens every now and then. When the umbilical cord is wrapped around the baby's neck, that's a medical emergency also. And they will oftentimes try to reposition that baby, so to remove that cord. But a lot of times that calls for a C-section. They'll send mama into a C-section so that baby doesn't strangulate and not get oxygen during the birth process. Reasons for this is oftentimes a result of violence or an injury. It can result from drug use. It can result from severe anemia, which a woman who's getting good prenatal care should have treated anemia. Thyroid disorders, they check on your thyroid hormones quite a bit prenatally, and women who are abusing alcohol or drugs can have this. It's the body's way of sort of saying, we're getting poisoned here. In that. The ectopic pregnancy we've talked about already. This is about 1 in 50 pregnancies, and that is when the embryo doesn't make it all the way down to the fallopian tubes and down into the uterus to embed in the uterine lining. It embeds in the fallopian tube where it doesn't belong, and it's very painful for women, and it's an absolute medical emergency. They will either do an injection to try to target exactly where that embryo is, and do an injection where it tries to break that up. So, I mean, obviously it kills the embryo, but trying to break it up into tinier cells where it can move along down the fallopian tube. But normally what they will do is get in there and take that entire fallopian tube out, which is going to reduce her fertility. Remember, we tend to ovulate 1 egg every other month, and so every other potential pregnancy is in the alternate fallopian tube. Questions about any of this stuff, some of these complications? Okay, some more complications that they're usually screening for: hemolytic disease or Rh factor. For those of you who know your blood type, you know you're either O, A, B, AB, but then you're plus or minus. So like my blood type is O positive, which is the Rh factor. When a mom is negative, and they'll check mom's blood during the pregnancy, and then they usually check partner's blood during the pregnancy also. One of my friends had her doctor very tactfully ask her during the pregnancy, who was the father? And she said, my husband. And she said, I'm going to check your blood type. This is kind of like a paternity test. And so the doctor was giving the mom the opportunity to let her know if husband was not necessarily the father. Okay. Which was kind of a tactful thing to do for a doctor. But you can tell this with a blood test. So my mom was negative and I came out O positive. And because I was positive, my mom could have formed immunity for the next baby, my sister. And doctors need to know that, because immunity could mean your immune system could reject that baby. Does that make sense? And I still remember, I was about 6 years old. I still remember fainting because they took my blood to verify that I was positive, and therefore making sure that they had the treatment available if my mom needed it for my sister's birth. Okay, so there is a treatment if they know. Preeclampsia or eclampsia, which is oftentimes called toxemia. Very good friend of mine had toxemia during both of her pregnancies and had to be on bed rest, and then she had to be hospitalized for a long period of time. We would sneak food into her in the hospital room. Earliest signs are hypertension. And this is when women are getting, it's almost like their body is responding to the baby as if it's a foreign body. So it's kind of like an immune system rejection. Okay. And in the process of doing that, she gets protein buildup, she gets edema and a lot of swelling. She can get headaches. And this is a medical emergency also, because mom can go into a seizure and die. If anybody in here is a Downton Abbey fan, in Downton Abbey, there was a birth, and the mom was able to birth the baby, but then she seized after she had toxemia, and she seized afterwards, and mom died after the baby was born. Okay, so they will normally on a regular basis check your blood pressure. They normally screen urine on a regular basis. They normally screen blood on a regular basis in prenatal visits. Preterm labor is labor that happens anywhere 37 weeks and before. Severe stress can send women into preterm labor. African-American women are more likely to go into premature labor and have preterm babies. Some of that is believed to be more biological, but a lot of that has to do with more sense of stress in their lives. Women are a lot more likely to go into premature labor when they have multiple fetuses. So if they've got twins or triplets, those usually come early. They will monitor those women very carefully at the starting in the second trimester, trying to prevent preterm labor. A friend of mine in her 40s, and I'll tell you this story, she had 2 grown children, married again right at age 40, gave her new husband, she said, "You've got 1 month," meaning we've got 1 month without birth control. She got pregnant on her honeymoon with twins. So she was 40, so twins were higher risk. That woman carried those babies full term. She had 20 pounds of babies in her. So she went to 40 weeks with those twins, 20 pounds of babies. You know, I was whining when I birthed the 7-pound baby with the Humpty Dumpty head. I cannot imagine birthing 20 pounds of babies. Whew, man. Okay. It's no wonder that women's bodies go into preterm labor. It's just like there's just so much pressure on the cervix. And in a lot of ways, like I talked about that lightning, when that baby's head goes down in there, that's kind of telling the cervix, hey, we're getting ready here. Another thing that they check for nowadays, and they did this back when I was pregnant, they go in and they do a little swab later on in your pregnancy to make sure you don't have a strep infection down there. Because a strep infection that can be treated, we're normally used to thinking about strep in our throats, but we can get strep down there. Sometimes when women get an UTI, they will culture it, and sometimes it comes back as different kind of bacteria, and sometimes it comes back as strep. And then if it is strep, that's a different antibiotic than what you normally would treat a UTI with. So basically, I'm telling you, we got this bacteria down there, okay? But if it's a strep infection, they will treat that because that tends to cause premature labor. So it's a really treatable way of preventing that from happening. Postpartum depression, ideally, midwives and OBGYNs are regularly screening after pregnancy for moms if they're experiencing any postpartum depression. During my second, I was in different places for both of my babies. After my second baby was born, I thought it was really sweet. The nurse who I just loved in that office, she would call me once a week and just ask, like, you know, how's your bottom healing? How's the nursing going? And she would usually say it, how are your spirits? Are your spirits doing okay? Are you finding yourself to get blue? That type of thing. So just very sweet. It was really nice to get those phone calls from Elaine and to be able to process that. Then we've also got to be very, very careful that moms aren't experiencing postpartum psychosis. Who's the woman, I'm blocking on her name, well, there was one woman who killed her kids in the bathtub because she thought that they were so evil that God said to kill them, and she killed them. And then there was another mom in a Texas case where she drove her babies in her car into a lake and drowned them. Both of those women were experiencing postpartum psychosis. And both were in their paranoia, in their psychosis, being told that they need to kill their babies because there was something wrong with them, or they were evil, they were sinning, that kind of thing. So really, really sad. So again, ideally, women are being screened for this. Family members, partners know what they are looking for and how to get help when moms are experiencing this kind of stuff. Across the years, I've worked with many patients with postpartum depression, and I absolutely love working with these women because a lot of times the stuff that seems very intuitive to me has not been taught to them. So as an example, a lot of women are expected to believe like, oh, I'm going to fall in love with this baby like I've never fallen in love before. And it's just like the most wonderful thing that can happen to a woman. And I can tell you that oxytocin really works. Like I fell in love with my babies. It really was a sweet thing. And that made the diaper changes and the laundry and the breastfeeding and the tender nipples and all that kind of stuff worthwhile. But for a lot of women, that doesn't happen. Like they are miserable and they don't bond with their baby, and then they think there's something wrong with them, and it's supposed to be the best love they've ever experienced, and it's not. And there is so much redundancy, you all, and so much sleep loss. During my first, I was not able to nurse my first son, Christian. I was in the middle of my pre-doc internship. So I was in year 5 of my graduate program. I had absolutely no maternity leave. I had my baby the joke was I had a baby over the weekend and came back to work. I had a week off. And then I had to buy illegal baby care. Like you could not put a baby into childcare until they were 6 weeks old in the state that I was in South Carolina. But I had to buy illegal care. She was fantastic. This woman I found who had her own toddler, and she was so good to my baby. But I had to be at work. I had to be at internship. So it was quite a dilemma that I was in. I got so exhausted. I was so tired. And I still remember in the middle of the night, somewhere around 4 a.m. and I was attempting to nurse my baby, which was not going very well because I was trying to do it at night and not all day and all night. And I definitely wasn't well rested, and I definitely wasn't sleeping well. So of course I didn't produce milk, and we had to go to a bottle. But I remember nursing him somewhere like he's like a week, 2 weeks old, in the middle of the night around 4 o'clock in the morning. And I was so tired. And I remember thinking, what if I get psychotic? Like, what if I've gotten so little rest that I get psychotic? And then this feeling of relief washed over me. And the relief was, I'm working in a psych hospital right now. If I go psychotic, cool. They're going to come along and give me some Haldol and let me sleep. It was like, what better place to go psychotic than a psychiatric hospital? And it was just like, okay. And then it was sort of a release of like, okay. And I didn't go psychotic. I was very sleepy, and I had a chronic headache, but it didn't get that bad. So knowing what to look for here. So there's lots of hormone fluctuations going on there. Mom's body's going from pregnancy hormones, trying to get back to regular periods. And that's a dramatic shift for moms. The sleep is just, that's whoever said sleep like a baby. No, they usually have their days and nights mixed up. Okay. They were used to having a party in utero when mom was sleeping. And then when mom's up and walking around, they tend to sleep during the day. So they come into this world backwards, and new parents have to deal with that. Okay. My firstborn was very colicky, and he would, like, right around the time of night, it was time to go to bed for adults, he would get colicky and cry, and he didn't have a good wah. He had like a bark. He barked. I told my daughter-in-law this. I said, oh, you might have a baby that barks. It wasn't like wah. It was like, and so it kind of hit every little nerve you had, and you just wanted to satisfy it. I learned over time, I would papoose him and get on the treadmill and walk him. And then when I needed to do something, I would put him in his car seat and put him on the dryer secure, not so he was going to like vibrate and fall off, but he would be on the dryer getting vibrated, and he liked vibration like that. He really liked that. That helped with the colicky, and it helped with the barking. Okay, the redundancy, diaper changes, feeding, diaper changes, do some laundry, try to sleep, more feeding, diaper change. You know, it's just like all this stuff over and over again. And when I've worked with postpartum women and they've had that, it's like, oh yes. And then just trying to figure out when the heck you're going to be able to take a shower kind of thing, or when you're going to be able to eat, or when you're going to be able to sleep. They don't sell them anymore, but my sons loved the bouncy baby. You would hang it on the door, and then you'd sit them in it. And my boys loved it. They would be like, bing, 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 bing. But I remember, them saying like, you should put it on one door hinge, but not move it around. But that was how I took a shower. Like he would be on the bathroom door, and I would take a shower, and he'd be with there, bing, 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 all happy. But I think they were dangerous. I think sometimes people treated them like a swing and then they'd pop off. But my guys absolutely loved it. It was like a bungee cord for babies. What's happening in work change? Again, moms are happiest if they're doing what they want to do. If they return to work and they want to be back at work, they're going to be happy. If they want to stay home and they can stay home, it's when they're doing the other that it's really stressful for mom. And then how much partner care she's getting and how much help she's getting. One of the unfortunate things that has happened for a lot of families is people move away from their kin. They move away from their extended families. And so there's not that kind of care. There's not that mom helping out the new mom or sister helping out the new mom like there used to be. And certainly postpartum depression and postpartum psychosis are very risky for mom and newborn. And so screening, providing medication and psychotherapy, ideally psychotherapy and not the medication. Okay, I'm going to go ahead and let me stop share. I'm just going to play one of these. I watched this again this morning, and I'll warn you, I might cry again. Okay.
I may be in labor, and I'm freaking out because literally, if this is not real labor, this is awful. And I've literally been having really bad menstrual cramps. It feels like really bad menstrual cramps since 4 this morning. I woke up and then I started having contractions, but I feel it all in my back. Like it is 100% back labor right now. And I'm in so much pain and I'm so uncomfortable. So I was hesitant to go to the hospital at first because I was like, you know what, this is false labor. You're fine. But now I'm like kind of freaking out because I'm like, this might be real. So I had called my doctor and she told me just to head over to the hospital because this might be it. Logan literally might be coming, which is crazy. But I just got dressed and threw some curls in my hair and ready to go. So when I get to the hospital, I will update you guys because it has been already an adventure and we're hoping and praying that this is not false labor. So say a prayer, this isn't false labor and that this is the real deal. Sure keeping you there and like everything else? Yeah, they're waiting. It's full upstairs in labor and delivery. So I won't go up until like 4.
You can definitely tell when she's having contractions and when she's not.
Okay, so I'm in triage and what's happening? What time is it? It's 3:20. My blood pressure was high, and I was 2 centimeters dilated, so they're deciding to keep me and admit me upstairs. But upstairs is filled, so I have to wait down here until I can get a room. But
2 centimeters is just starting later. She's just
So where
barely
are you
in.
having your pain at? Is it all in your...
no, right now it's in the front, but I was having a lot in the back. Just give me a second. But it's 3:20, and Jovian and my best friend Michaela aren't gonna be here till like midnight.
Right.
So I have to make it till midnight.
Frozen, I held my
See here how it's balling
right
up? That's a
from the
contraction.
start.
It gets
I
real
knew
hard.
that I found a home for my heart. Beats fast, colors and promises. How to be brave? How can I
Look at how beautiful. Say hi. There's Logie.
watching you stand?
She's on the bouncy ball.
All of my doubt suddenly goes away.
This isn't helping. This isn't helping. Mom, hold on my back, please get it out.
Somehow, one step closer. I've died every day waiting for you. Darling, don't be afraid. I have loved you for 1,000 years. I love you for 1,000.
Take deep breaths.
I was this close to getting my
And the doctor was called away for an emergency. So now, yeah, the doctor said he got called away for emergency. I don't even know what that means. Like, he literally came in here 30 seconds. He said he'll be back. And he came back not even a minute later and said he had an emergency. So I don't know. He didn't say what it was. So, yeah, so I don't.
One step closer.
I am now, it is, what time did that say? 7:50? 7:51. And I am 6 centimeters dilated and 100% effaced. And I just got my epidural.
Feeling good now, huh? The epidural kicked
Doesn't
in?
she seem better?
Kicked in?
7 pounds, 3 ounces and 21 inches.
And I said 7 pounds, 5,
Okay.
7'5" and 20.
They're making bets.
Baby's weight and length.
Bigger things right now.
I'm gonna go 8 pounds, 2 ounces.
8 pounds, 2 ounces.
Yeah.
Go, Dad.
714 pounds.
What?
7'14".
7 pounds, 14 ounces.
Ounces, okay, and length.
About that big.
Seriously. They haven't checked me in a while. Last time they checked me was around 8, and I was 6 centimeters, 100% effaced. My water has not broken yet, but Logan's doing good. Her heart rate has been really good. My blood pressure has been good. So they're letting me ride it out until my water breaks on its own, so that Jovian can get here in time. So they haven't broken my water.
So a lot of times water breaks on its own. which is where the placental membrane, it breaks and amniotic fluid starts coming out. And I can tell you with contractions, it feels like it's very warm. It feels like you're really peeing on yourself when that amniotic fluid comes out. If the membrane has not broken, but the mom's in labor, what they oftentimes will do, and they did this for my first birth, they get in there with what looks like this little crochet hook, and they go inside the cervix and they break it. And the reason why they do that is it usually speeds up labor. It just moves things along. In her situation, she's waiting for people to get there, so they're holding off on doing that.
And it's still intact, and they haven't checked me. I'm not feeling a lot of pressure, so I think things are okay. There's Logan. She's still in there, and that's it.
I died every day waiting for you. Darling, don't be afraid. I loved you for 1,000 years. I love you for 1,000 more.
12:50, she just got checked.
Not 8.5 centimeters dilated. We're still intact. The nurse is going to go check with the doctor and see if she wants to break it. Just in case my other girl.
So she got dosed again.
8.5. It's supposed to be 10.
She's getting tired.
All right. What time is it? 2:30. It is 2:30 a.m. It is now the next day, June 21st. I've been in labor for 24 hours at this point. And my doctor just broke my water at 1:48. And we went up on my medicine for the epidural. And I'm losing all motivation. Right? I can't even hold this. I'm so weak and tired.
Guys, it's about, it's 3:30 now. They just came in and checked her again to see where her cervix is, and it's 9.5. But she still is in a lot of pain, back pains, stomach pain, wherever she can find the pain, that's where it's at. Okay. So.
It's in my back, it's in my stomach, it's everywhere. Oh, this is a bad one. Oh.
Breathe, yeah, breathe through it. Breathe through it.
They asked me in my second delivery, right about this time, they wanted to know if I wanted to have my tubes tied after the birth, because they do that, pretty quickly, for birth control. And my answer was, yes, I would like my tubes tied 9 months ago. I didn't get them tied, but anyways, it was like, that is not the time to ask a woman that question.
Oh my
going, keep going, keep going, keep going.
So you're waiting to push when a contraction happens. So you're working together with that contraction.
Good. Keep going, harder, harder, harder. 9, 10, left, yeah. One more, come on, you got it. Make this it. There you go. Push if you can.
She had to push for over an hour. That's a long time. Again, my babies are out in just a couple pushes.
Screaming for us.
So they're both cleaning the baby up and stimulating it, which helps with the breathing.
Okay, yeah, she's
Almost done. There we go.
yeah. She's scared.
There it is.
Got some chunk to her.
I lose my breath whenever I see you. You stole my heart, what is it that you do? My life was great till you added colors. Like the moon needs the sun, we don't care about the others. You set my world on fire. You're my heart's desire. I just
Healthy looking
wanna
baby.
love you, just wanna hold you, just wanna be with you till we grow old. Please tell me you'll stay or take me away. I want you for myself every single day. You set my world on fire. You set my world on fire. I don't know what I'd do without you. You make me smile, what is it that you do? My life was great till you added colors. Like the moon is the snow, we don't care about the others. You set my world on fire. You're my heart's
baby.
desire.
How's everybody doing? I like her depiction of it because she didn't, gloss over how much it was hurting, and she didn't gloss over how long it took and how exhausted she got. But then you definitely get that feel for just how beautiful and how sweet it is once it's all said and done. Women do get, there's some hormone that happens in them that helps them forget some of the pain. And so there's obviously some biological adaptation to that. Anything that you saw that you didn't like know about, or stuff that we've talked about today that's kind of new to you, or scary or worrisome, or
I have a question. And I don't know if it's true or if this is going to make any sense at all, but so natural, that's a bad word, but is it better to have a child standing up? Like, I know you can't do that, but like how gravity would work. And then like, why do we lay down when we have a child or giving birth?
that's a very good question, Katie. And a lot of it is part of the medicalization of childbirth. It's convenient for the person who's delivering the baby or catching the baby. But a lot of women don't do that. And midwives, if any of you've seen the Netflix show called The Midwife, one of the things I really like about that show, they handle some very important women's issues. But they show the midwives delivering babies in moms in all kinds of different positions. So in some situations, she's squatting. In some situation, she's leaning over a table. In other situations, she's on her side and the midwife gets in there and lifts one leg up and delivers the baby like that. A lot of times you don't know what's going to feel like the most comfortable position until you get in there and you're in labor. And like I said, when I had back labor, I learned the more I could scrunch over, the better it helped with that. But in my other delivery, I wasn't doing that. Like I didn't have the back labor as an example. And definitely in like tribal times, women were not laying down on the hospital bed. They were usually squatting, or like she was on the bouncy ball for a little bit, but then she was saying it wasn't helping, or walking around. Yeah, all of that would help gravity. Yeah. But again, that's sort of convenient in the hospital setting, that convenient of, I can sit here and you're at eye level type thing, as opposed to like call the midwife where, they're on the floor, they're on the bed, they're just wherever that woman needs to get in the most comfortable position for them. More like doing gymnastics to deliver a baby.
I actually did research on that last semester, and there's some studies out there talking about vaginal tearing and laying down on the bed versus in like birthing chairs or like in water baths, and it's because like it's just not meant to be horizontal.
That would make sense. It would make sense, yeah. Have you all heard of the water births? Yeah, that makes some sense too, because you know how we're lighter in water. Wouldn't it make sense that everything would feel a little bit lighter in the water, as well as it's usually warm and a little more natural, getting back to our roots kind of thing. Other comments, questions? I'm going to have to watch Call the Midwife tonight because I need more baby fix. That's what I like about that show. It's like I'm able to kind of like, every now and then something bad happens in the show, obviously, but and it's amazing. I don't know how they have casted it. They must have their studio in England near a maternity ward, because they're really newborns. They're not like in a lot of TV shows where they fake the birth and then you've got like this kid that's like 2 months old kind of thing. And they make the baby, I don't know how they do this either. The babies look like the moms. Like they're not, really showing that mom really having birth, but somehow they're able to cast them so that they look like mom. So it's an amazing show. If you haven't seen it and you get a chance to check it out. Any other comments, questions? I hope we didn't have any fainting. When I've shown this in class before, I've had students faint. Aiden, Alea, Rihanna, are you okay?
I am good.
Okay. Okay. Don't need to send the paramedics to anybody. All right. Well, next week we start the chapter presentations. And so I look forward to that. Come see me during my office hours today if anybody has any questions, and otherwise I'll see you. Y'all take care.